How is TB and HIV co-infection treated? When it comes to treating tuberculosis and human immunodeficiency virus co-infection, a coordinated approach is key. This means addressing both infections at the same time to improve health outcomes and reduce the risk of death. The treatment plan typically includes standard tuberculosis therapy along with antiretroviral therapy for HIV. For tuberculosis treatment, the standard regimen usually starts with an intensive phase lasting 2 months. This phase involves taking for medications, rifampicin, isoniazid, pyrazinamide, and ethambutol. After this initial phase, patients continue with rifampicin and isoniazid for at least more months. In total, the treatment generally lasts 6 months, but it may be extended to 9 months in some cases, especially if antiretroviral therapy is not given or if the patient is not responding quickly to tuberculosis treatment. For individuals with higher CD for counts and no significant drug interactions, a shorter regimen using rifapentine and moxifloxacin may be an option. However, if someone has drug-resistant tuberculosis, they will need a specialized treatment plan, often created with the help of experts. Now, let's talk about antiretroviral therapy. All individuals with tuberculosis and HIV co-infection should start this therapy, regardless of their CD for count. It is best to begin antiretroviral therapy as soon as possible, ideally within 2 weeks of starting tuberculosis treatment, especially if the CD for count is below 50 cells per microliter. If a person is already on antiretroviral therapy, healthcare providers must carefully manage any potential interactions with tuberculosis medications, particularly rifampicin. This may require adjustments to the antiretroviral regimen. Adherence to both treatments is crucial to ensure effectiveness and prevent drug resistance. There are also special considerations to keep in mind. For instance, if someone has tuberculosis meningitis, the timing for starting antiretroviral therapy may differ, and this should be guided by a specialist. Pregnant individuals with tuberculosis and HIV should receive standard antiretroviral therapy and preventive treatment for tuberculosis after confirming they do not have active tuberculosis. However, safety data on newer tuberculosis and antiretroviral drugs during pregnancy is still limited. Additionally, preventive therapy with isoniazid is recommended for people living with HIV to help prevent tuberculosis disease, especially if they do not have active tuberculosis. Monitoring is essential throughout the treatment process. Healthcare providers should closely watch for side effects, drug interactions, and adherence to the treatment plan. Integrating tuberculosis and HIV care through systematic screening, prevention, treatment, and support can significantly improve health outcomes. Treatment plans should be tailored to each individual based on their specific circumstances, including drug susceptibility and the site of tuberculosis disease. In summary, effectively treating tuberculosis and HIV co-infection involves starting standard tuberculosis therapy alongside prompt initiation of antiretroviral therapy. It is important to manage any drug interactions and ensure adherence to both treatments. This evidence-based approach aligns with global health guidelines and is customized to meet each patient's unique needs, ultimately aiming to enhance treatment success and reduce mortality. Always consult a healthcare professional for personalized medical advice.